you're looking for social justice informed care, you are in the right room. My name is Ayana McGee, she, her pronouns. I am the project co-director with CMHEP TA Center, and we are here to bring you a series of trainings and other virtual learning opportunities over the course of this next year, one of which is the one we're hosting today. So with that being said, welcome in. Just want to start us off with a quick disclaimer. This training is offered through the Community Mental Health Equity Project, CMHEP TA Center, which is funded by the California Department of Healthcare Services, CHCS, and administered by the Center for Applied Research Solutions. The views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the California Department of Healthcare Services. So the CMHEP TA Center receives AB 74 funding administered by the California Department of Healthcare Services to provide TA to counties and CBOs, community-based organizations, as well as support DHCS with updating cultural competence plan guidance, which guides and supports counties in planning that leads to systems that are aimed to reduce behavioral health disparities. The Center for Applied Research Solutions is the lead CMHEP agency to implement this technical assistance, trainings, and consultation services. As part of the larger CMHEP initiative, I also want to note that the California Department of Public Health Office of Health Equity also receives AB 74 funding through CMHEP to contract with 34 community-based organizations to further support the efforts of the California Reducing Disparities Project. So for those of you who are familiar with CRDP, this broader initiative is also connected to that as well. We are very fortunate to have a partnership of agencies within the CMHEP TA Center with subject matter expertise regarding cultural competence plans, health equity, and other issues, and are able to provide training and technical assistance throughout California, such as BEAM, who Dr. Megan is representing today, the Black Emotional and Mental Health Collective. Our goals on this project are to help county stakeholders learn about behavioral health equity topics and trauma-informed services. And again, ultimately, our center is available to provide training and resources that support counties and community-based organizations with working together toward reducing behavioral disparities. Throughout everything we do, our approach is to be equity-driven and anti-racist, strengths-based, trauma-informed. We value lived expertise and community engagement, as well as collaboration and data for equity. These values inform the content that in the TA that we provide. It informs the experts we work with to provide that TA, as well as the learning modalities that we offer. And we try to put these values into practice, even in our virtual learning events. So you'll notice, when we host these events, we try to put a video that is culturally affirming at the intro, just to give folks a moment to take a breath, take a space, take a time to just sit and listen and ground ourselves before we get into the content. We also encourage folks to use inclusive and non-stigmatizing LGBTQ affirming and anti-racist language as we participate in these events together. So for example, you'll notice that we don't use the term, or we'll avoid the term crazy when we're referring to mental health issues. We use first-person language, and we are respectful of pronoun use. And so we just ask that folks are mindful in this space as we all engage together. Many of you might be coming from county behavioral health departments, you might be ethnic services managers, MHSA coordinators, or other types of county staff and providers. Many of you also might be coming from community-based and faith-based organizations, ethnic organizations and networks. Wherever you're coming from, we welcome you into the space and are grateful to be here with you today and learning together. Our services, I also want to note that we just offer an array of virtual learning opportunities like the one today, which is a webinar, but upcoming, we'll share a little bit more information later toward the session. But we'll have virtual learning collaboratives, leadership academies, and other more longer term peer-based, cohort-based type learning opportunities as well. So just stay tuned, keep checking our website, and stay tuned to our listserv as well. All right. And with that being said, I am so extremely happy to be passing the mic over to Dr. Megan O'Reilly.
My name is Dr. Megan. I use she, her pronouns. And this is a few bullet points of how I show up and serve the world around me. So I am a psychologist. I have a private practice and business called Inherent Value Psychology, Inc. I'm a DEI consultant. I focus on self-worth, and I served at Stanford for 6 years as the coordinator for outreach, equity, and inclusion. And I still get to teach there a couple of classes around motivation and a wonderful new class called Thriving While BIPOC. So that's my lens that I bring to today's discussion. So happy everyone's here. I saw outpatient, behavioral health, people who are supervisors, trainers, scholars, a lot of county health. And so really talking about social justice informed care is going to be a really good use of our time. Just one more quick shout out on behalf of Beam, who I'm representing today. Here is our mission. With all of you in the room, I just really want to uplift Beam so you have it in your Rolodex as a source of a referral and understanding our aim. And so Beam is a national training movement and grant making institution that is dedicated to the healing, wellness, and liberation of Black and marginalized communities. And so as we move through today's topic, you'll see just so much synergy with what we're talking about. Okay. Just a few quick intentions. I want you to be able to locate me during this presentation and why we're discussing what we're discussing. And so I want you to listen with your full self. This is an invitation. What do I mean by full self? Well, a lot of us have a lot of expertise and might be coming to this very cerebrally. I would love for us to go below the chin and listen with our heart, listen with our gut, listen with our intuition, just all the other ways of knowing that sometimes get left out of intellectual discussions. So open up your full self, see what resonates. I hope that you're challenged. That's where we grow at the growth edge, right? But also inspired. I think those two come often together. And then most importantly, I hope something that you gained from here today gets translated into more informed, more socially just care for your clients, your students, yourself, anyone that you move with in life. Okay. We know the learning objectives. That's why you came. I am going to speed through the first couple set of slides. I'm going to kind of accordion our time here, our precious 50 minutes, because I really do want to get through all 7 of the social justice mindsets. So I want you, as we're going through these mindsets, to try to locate yourself. Am I in colorblindness? Am I in multicultural? Am I in diversity? There's going to be a few points for reflection for you to do that. I do want you to walk away with a better understanding of equity versus equality. And then my favorite part, talking about liberation psychology. And hopefully you have a few nuggets of how to incorporate that into your practice. Okay. We're gonna speed through some of these because they're just backdrop. Why is this course needed? Well, we're still in a very contentious climate, right? There is a wave of BIPOC people, Black, Indigenous people of color, coming to counseling for the first time, right, since the pandemic, since all the racial trauma and re-experiencing that happened in 2020. And so we must be informed, regardless of our own constellation of identities, of how to meet and treat this wave of newly coming folks to therapy, right? And we can all attest to this, the unrelenting climate of both political, social climate, actual climate, weather, all these different things that are impacting our well-being. So wrap all that up in the continued instability and violence to certain communities. The time is now to really think about social justice care. And anyone who might be trained in cognitive behavioral therapy or just really loves language, I wanted to start this social justice informed care workshop our webinar with just really defining some terms. If we're going to get to social justice, I thought it might be nice to define oppression first, right? So when we're thinking about oppression, all these things come to mind, right? Um, Power, one group having more influence, say, coercion over another, embedded norms and habits and symbols that might be diminishing and discriminatory to other groups. All these things I hope are coming to mind when we're thinking about oppression. And when we look at the literature, these are the gears that make oppression run, right? And there's a resource list at the end. But cultural imperialism, powerlessness, marginalization, of course, violence, and exploitation, right? Any one of these could be its own deep dive, but this is the system that we're talking about when we're also talking about social justice, right? And our clients, students will be coming in with experiences of these in some way. We also have the levels, right, that you can read in more detail on your own time, but internalized oppression, so the smog you breathe in over time and exposure, structural, this is the part we're going to be dismantling, and institutional, right? It really echoes out up through these levels. And then we know that we're being impacted spiritually, physiologically, psychologically, more instance of all these different psychological impacts, cognitively and socially, right? And so oppression is happening, it's having an impact. That's what brings us here today. So that is oppression. What then is social justice? I had a full day opportunity to give this training, and we really got to define it for ourselves. So before I show the next slide, you can kind of start thinking about what words come to mind, what practices, what embodiments really typify social justice. But for me, this quote by an Aboriginal activist, Lilia Watson, really kind of captures part of it for me. And she says, if you've come here to help me, you are wasting your time. But if you have come because your liberation is bound up with mine, then we can work together, right? This is a really good statement for allyship as well. We're not just bestowing help, we're actually changing a system that it will benefit all of us. Okay. I hope some of these words came up for you when you were thinking about your definition of social justice. Fair and equitable, the distribution and access of goods, civil rights, deserving, human well-being and flourishing. Okay. Let's start to slow it down a little bit now. I want to take you through something that the first time I saw it was very impactful, and it really helps us steep into the work of why we're talking about social justice informed care. Some of us sometimes might think, I'm just going to stay in my lane and do my work, and it's not political. I personally believe that the personal is political, and whatever your client is coming in with, if you excavate deep enough, you'll run into a system. Okay, so let's look at this. Here's a question. We're going to be talking about Melanie. Why is Melanie in the hospital? Because she has a bad infection in her leg. Okay. Why does she have a bad infection in her leg? She has uncontrolled diabetes. This happens. Okay. But why is her diabetes not under better control? Fair question. She hasn't been taking her prescribed medication. Well, this is starting to sound like a Melanie problem. Why isn't she taking her meds regularly? She can't get to her appointments regularly and can't afford the medication. This is a class issue. Okay. Well, why can't she get to the clinic? It has free medication. Okay. Her neighborhood is unsafe and there isn't access to affordable transportation or reliable childcare. Now we're seeing a little bit more about Melanie's life and the choices she's having to make. But why did she get diabetes in the first place? Let's start there. She eats cheap, unhealthy foods, probably lives in a food desert. Why doesn't she eat healthier? Because she lives in a food desert and has a poor understanding of health and nutrition, and so on and so on and so on. Sometimes when you ask 5 whys, you're going to start excavating more of the picture. Let's do one more. Why is Jason in the hospital? Jason tried to commit suicide. Why did he try to do that? He's been drinking and using a lot of drugs in the past 2 weeks. And why has he been on this binge? He was trying to escape the depression of being, the desperation of being homeless. I like to say trauma is usually the gateway drug, not weed or alcohol or anything else. It's usually an escapist tactic, right? Why is Jason homeless? He lost his apartment in a rough part of town and was robbed while sleeping in the park. Why did he lose his apartment? His job at the local fast food restaurant didn't pay enough. Why was he working there? He never graduated from high school. Why didn't he complete his education? Because he had been abused as a child and bullied in school because of his obesity and tattered clothes, and so on and so on and so on, right? So, what we see on face value, the symptom, the presenting concern, usually has a narrative that will ripple out into a system if we ask further enough, further enough. Okay. So, we're about to look at the 7 social justice mindset that I have put together just to help us hold how psychology and how healthcare can think about our evolution toward where we want to go. I call it the long road to liberation. So, go ahead, get a little bit more comfortable, take each mindset in, do jot down your questions because we'll either answer them at the end of today or in a follow up communications and email. Let's dive in. This is our route, right? We're going to proceed to the root of liberation. And we're going to start with colorblindness, okay? Mindset 0 is actually overt isms: racism, sexism, capitalism, ableism. So mindset 1 is colorblindness. Oftentimes, behaviorally and culturally, we have a pendulum swing, right? So in the effort to not be overtly, let's say, racist or sexist, we'll move in the other direction and say, I no longer see color, right? So this is a mental orientation where we practice the belief that we're treating everyone equally if we no longer see the differences, right? It is an attempt to move away from overt racism and try to just kind of put a blind eye on everything. So color blindness. Okay. Here's the trouble with colorblindness, however. It allows racism and all the other isms to operate undetected because we're no longer seeing it, right? Ibram Kendi, our leading anti-racist scholar, is famous for saying that the heartbeat of racism is denial, right? So I just don't see it and I won't acknowledge that it exists, okay? If I don't see it, it's not happening, right? I don't believe it's occurring, thus I can't make meaningful change, right? It doesn't fit in my worldview, right? And so basically colorblindness is the big fish. It's not really seeing the experiences of these other fish downstream, okay? So let's look at this with the case, right? Let's say we have a client whose name is Branson. He is 50-year-old African-American cisgender male. He's upper middle class. He's in business. He's a manager. He's married to a white woman and lives in Boulder, Colorado, which is pretty upper class and conservative. He lost his mother due to COVID, and he's coming into you now. He's also raised Christian and considers himself spiritual. His presenting concern is headaches, forgetfulness, doubting life choices, loneliness. Even pre-pandemic, he was feeling lonely, okay? Your approach might be to assess depression, give him some psychoeducation about the stages of grief, do some grief counseling, set some new and realistic workload expectations as he's grieving, and maybe do some behavioral activation for this low motivation, and hopefully thinking about tribe and fighting back against this loneliness. This sounds like a good protocol, right? However, with Branson, some things that you need to think about and moving out of being colorblind, that's what you would do for maybe anyone that presents that way. But Branson is an African-American above 50s male, right? He identifies as male. So in assessing depression with Black people, it can usually go undetected because some of the symptoms show up differently, right? He might not be showing so much impaired function, and he's going to have a lot more somatic symptoms. Black and brown folks usually somaticize their pain. He's having aches and pains, right? And he's more likely to have a dysthymia rather than an acute major depressive episode. So really tailoring who is in front of me and how does my protocol change as a result of that, instead of a blanket standard good approach. Okay. Also listening to the narrative of his mother's death to COVID, right? The Kubler-Ross stages are good, but she probably had an untimely death. We know that a lot of African Americans had a disproportionate rate of death to COVID. So what are the inequalities in the healthcare system that we're a part of that you might want to pull out, right? Did something fail her? Can you hold his righteous anger around that? What other stories might he have around the Black women in his life in the healthcare system? That would be important to pull out in a narrative therapy type of way. And that would shift us out of a stock colorblind situation. Let's look at one more client. This is Clara Munoz, 30-year-old Latina, cisgender female, upper middle class upbringing, works for an accountant firm. She has started her own practice, recently engaged, lives in Arizona, raised as a Catholic, and her drinking has increased, and her presenting concern is transitional stress, right? You might conduct and administer an assessment on her alcoholism or potential over drinking, recommend group therapy, maybe some mindfulness-based stress reduction, and explore what Claire's hopes and worries for her upcoming engagement. Right? Sounds pretty good. But if we were to go deeper into her identities that are coming up into the room, we might invert the order, right? We might start with the alcoholism, but instead we might look at those stressors and strengths. Claire is a woman in an unrepresented field. She lives in Arizona. What is the racial climate of Arizona for Latinx people? That might be something to bring into the forefront, even if Clara doesn't. And did we ask the gender of her partner? Turns out Clara is queer, and she's sitting at this intersection, multiple intersections of her ethnicity, her religion, and her sexual identity. So exploring and inviting to talk about that. Whom is she out to and is she not out to? And where does she feel accepted? Okay. In summary, on this first mindset, and we'll go deeper here than some of the others because we might be in this one in some degrees, is to understand and tailor your interventions to the presenting concern, but more to the person, the individual person, right? And the social, political, oppressive context that that person could be living in. We all just want to assume that foggy spots exist, especially when you're sitting across from someone with a lived experience who's significantly different than yours. And continuing that education and reading on how this presenting concern could show up differently, given the constellation identities, and then get curious, right? And have I gotten, comfortable with my cookie cutter approach to what care looks like? Could I be harming my client? How have I been actively or passively ignoring some differences, especially when the client doesn't bring it up? And how does my client uniquely embody some aspects of their, her, or his cultural identity? We like to say there's more diversity within groups than even between groups, right? So am I having a lens to that? These are some questions you can ask yourself. So before we push on to the next mindset, just give yourself a loving, compassionately accountable review. What do I think about color blindness? Could I be there? Okay. The next mindset is diversity. And typically, diversity as a term, as a concept, is very positive, right? We want more diversity. However, diversity as a mindset, it does encompass acceptance and respect, and it understands that there's differences now. So we're moving out of everyone's the same, I don't see difference, to yes, I now see these different categories, right? And it's important to highlight these. However, if we practice diversity mindset shallowly, it often can end up in a very stereotypical view of the person. So we went from no buckets, everyone's the same, too rigid categories and boxes, right? And so I like to call this the 31 flavors of diversity, where are the Baskin Robbins diversity, where many of us are trained in maybe a week in each cultural group. And Latinx folks, especially the male identified folks, it's all about machismo. Black people, especially Black women, it's about matriarch and independence, and I don't need no man. And for Asian cultures, which is so diverse, it's about filial piety, right, and honor. And so, if that's the flavors or the shades that large strokes we're dealing with, we're going to be exercising far more microaggressions. There's going to be a tokenism type mindset that we'll approach clients with, and we're likely to do more harm just by blanketing these differences, such like that. Okay. Let's look at diversity mindset with Branson. We remember Branson. So you might attempt to build rapport with Branson by giving him compliments about how far he's come or how articulate he is. Um, you know, it's hard out there for a Black man, you might say, in trying to build that rapport. Instead, we might say, tell me about your hardships and how you navigate this world as a Black man, right? Um, we might keep things cerebral and problem solving because he's a male, and solution focused, and not go very emotional, even though that's what he might need given the loneliness and loss of his mother, right? We might suggest that he processes anger in a manner that's very normed and comfortable for us, right? And not think about what are the cultural or even ancestral ways that he might need to process his anger, right? Let's look at diversity boxes with Clara. Um, do not assume that everyone comes out in their 20s and that she's past this experience somehow, right? There's multiple ways that queer folks move through their coming out process. It's actually quite continual, right? Um, we might inquire about that intersection between religion and sexuality. So, in shifting out of a rigid diversity mindset, we're going to honor that there's more variance within groups and between groups, and get to deeply know the human in front of you, not just their categories, but how that actually is embodied and lived in their individual life. You know? Do I expect my client to teach me what I don't know about their identifiers? How much am I seeking out further knowledge? What assumptions do I readily make, and how do I counter out those? The best tool for bias is making the unconscious conscious, right? And looking out for them. Okay. Oh, and I put this in here just because I've heard it and experienced it before that, do you pat yourself on the back when you have a diverse client? And what does that, and how are you defining that? What variables that are different than you that you call diverse, right? So let's really break that conversation open with ourselves. Okay. Where are we? We are on stop 3, multiculturalism. Let's talk about it. So now we've moved to not seeing any differences, to seeing rigid categories. Now we're seeing the rich dimension of diversity and differences in each individual. This sounds like a great place to be because it is. We're moving from tolerance to acceptance. It's multidimensional, it's intersectional. We're understanding the unique interplay of identities. This is a nice place. I don't mean to trigger anyone with this image. I remember studying it for comps a long time ago. The reference is in the notes you can check out. But I remember studying how just all the different intersectional permutations there can be for folks. You can see that dimension 1 is racial categories, and then dimension 3 is the different cultural levels of different things to assess. But even now, this would be even more complex of a, what is it, dodecahedron looking Rubik's Cube, because there's so many more identities that we can attend to. So multiculturalism does focus on the intersectionality, right? Which hopefully all of us are familiar with this word, but it's always good to look at it again, right? And it's this idea, this belief, really a philosophy and a truth that the identity markers do not exist independently of each other, and that each informs the others in beneficial and hindering ways due to oppression, often creating a convergence of privilege, oppression, and just lived experience, right? We have Kimberly Crenshaw to thank for this term, right? So if we want to continue to grow from a multicultural mindset, we will hold the truth simultaneously that some clients may fit cultural stereotypes and others will be very far from that arc. This is a nice call out or call in for clinicians of color, right? You've been sought out because you are Black, you're Asian, you're Latinx, you have some identity matching with your client. And although that is very healing inherently, we might assume even more that we have the same lived experience. So oftentimes with my clients, I'll say, I know what that's like, but tell me what it's like for you, right? Because it's always going to be nuanced, right? And so we get to get curious about how that intersection shows up, what strengths arises from these experiences, and do I see the client as the expert in their own life, right? We talked about our titles and our roles and where we're coming from, and we definitely have expertise. But as we're shifting into later mindsets, we'll see that sharing power in the room and allowing them to tell you what it's like is a very important, not only trauma informed care, but social just informed care technique. Okay, let's move on to inclusion. So, inclusion can have a couple different definitions. If you're working in a diversity, equity, and inclusion world, it's the extent to which various team members are able to have belonging, feel valued, and actually have access and participation. But in therapy, healthcare, more of the medical side of the world, it's the feeling of being meaningfully and purposefully included and incorporated in all aspects of your care, right? From communicating symptoms to treatment planning to medication management. How much do I feel like the care is happening to me or I'm a participant in this care? Okay. In therapy, it can look like collaboratively goal setting and prioritizing. I want to pause on prioritizing because oftentimes people come up with a lot of different needs and a lot of different goals. And you might adjudicate yourself which order they might need to come in. But collaboration and inclusion, justice care would say, which one are you able to tackle first? Which one is most pressing to you? And then following the client's lead, being almost a servant leader in that way. Active participation and conceptualization. For the therapist in the room, this is our domain, right? This is where we get to use all our book learning and say, this is what's happening for the person, right? But inclusion would say, how do I partner with them? I like to float my conceptualizations across my client. Like, let's consider this. Could it be a pattern from upbringing? What do you think that about how this is serving you or not serving you, right? Have you felt and seen this way before? It could be a part of this dynamic, right? So tentative questions, allowing them to endorse parts, if not all, of the conceptualization, and asking questions together, right? Kind of co-collaborating, walking alongside of instead of in front is how inclusion looks in the room and can feel. This last one there was transparency with challenges, right? I like to call a spade in my therapy room, and sometimes I say I'm going to push back on that, or I'm going to challenge you here, just so they can know why I'm coming at them in a different way than I usually do. Let's look at inclusion with Branson. Okay. We may think that he needs to process his grief and that doing that first will lead to a release of the depression. Well, it actually could be the opposite. It might be hard for him to jump into the grief first. So, collaborative treatment planning might be a good idea, presenting your case conceptualizations of what he's dealing with, and transparency with challenges, all those tools we just talked about. So, um, inclusion is not just having a diverse caseload where people look different on your caseload or have different sexualities or have different presenting concerns. It's about how you lead and follow. How do you terminate? Who do you terminate with soon? It is always a nice reflective practice to see who stays on my caseload longer, who do I have best rapport with, who has access to me and for what duration, and who is kind of leaving my practice or my care sooner, right? Sometimes that's really important data. What variables or identities might those people who terminate sooner have? Are there any trends in my attrition rate, right? What's the rate of my improvement across different clients? This is a little more data, but it can be illuminating to see how am I showing up with clients in a way that I don't see readily in the room. Are we there yet? You might be thinking, not yet. Stretch, get a snack. We're still on the road, headed towards the destination of liberation. But it's nice to take a pit stop. We have colorblindness, diversity, multicultural, and inclusion. Let's head now down to equity, a very popular word. But what does it look like in practice? Let me tell you a quick story. So I was at a social justice conference that was actually in lovely Utah, pre-pandemic, and the facilitator, the host, he asked us all to take off our shoes. And I didn't know where this was going, but being a little bit of a rule follower, I took off my shoes. And then he said, go find someone else's shoes and put them on. I know, a little cringeworthy, no little bowling alley spray. We just did it. We just put on someone else's shoes. And then he asked us to walk around in those shoes. So I have size 6 feet. My mom calls me Cinderella feet. I got someone's really big shoes, right? Clown shoes, we'll say. And I was flopping around in them, doing the activity, kind of cringing, but following the rules. And he said, does everyone have shoes on their feet? And we are all like, yeah, yeah. He said, this is equality. Everyone has shoes. No one's going shoeless, barefoot. And we're like, okay, good. And then he said, go find your shoes and walk around again. And after flopping in these clown shoes and putting on my snug little kitten heels, I was like, ah, this feels way better. I can walk way more efficiently, quicker, and do what I need to do and have my own personal style. And he said, this is equity. Everyone now has shoes that fit them and their actual feet. And I never forgot it. You know, it was a little gross, but visceral and memorable, right? So equality, everyone gets the same thing, while equity, everyone gets what they need, which usually isn't the same thing. This is where we can get a little uncomfortable, right? Again, our leading anti-racist scholar, Ibram Kendi, talks about how equity is a type of discrimination. Just now, discrimination cues very hot feelings, but really discrimination means discernment, right? Deciding who needs what, right? Who needs more, who needs less, and who needs what of what, right? So to understand equity, we must understand first the significant ideological ideas behind what is happening here, right? Many of us have seen this picture where there's 3 people of different statures, different heights, and they're trying to see the baseball game. And equality says they're all given the same box. However, equity says that the tall stature person actually doesn't need a box. The middle stature person gets 1, and the shortest person needs 2 to actually see over the fence, right? So racial discrimination is not inherently racist. The defining question is whether the discrimination is creating equity or is it creating inequity? Quote by Ibram Kendi, page 19, How to Be an Anti-Racist. So we actually have to go a little deeper in when we're thinking about discrimination. Is it creating inequity? That's the type of discrimination we're familiar with. Or is it creating equity, right? That's the type of discrimination we actually want to pursue. Now, we've seen in our culture that when one person isn't getting anything and another person's getting twice of something, that can be very uncomfortable. We've probably heard of the lawsuits about students suing colleges because they didn't get in when they feel like someone else, usually a person of color, has. I think affirmative action was just again at the Supreme Court. So we all have these experiences and narratives and vicarious hearings around what is this type of discrimination actually helpful or not. So give yourself some time to reflect on what you think about this, right? I'm unequivocally saying that this type of discrimination does need to happen, right? If it's thoughtful and creating equity, right? What does this look like in our therapy rooms? Well, When you think about creating equity, I think about access, full participation, and actually advancing the person, right? So just a quick table that I've created that we can look at longer another time. But access could be, do I have some sliding scale services or pro bono? We all had to get on the telehealth train, but that really opened up access for me, right? Black clients that I couldn't see in Oakland and Palo Alto, I can now see, or even in San Diego, right? Weekend sessions, being licensed in multiple states, offering accessibility to your office or your facility. Full participation can look like longer or shorter sessions due to neurodiverse folks. Do you allow them to record or take notes? What languages do you speak? And then advancement, we're talking about cultural humility here, evidence-based treatment tailored to the identities, and uplifting the human experience that's different for each person. Okay, I'm going to pick up on time here. What would equity look like with Branson? Well, it would start at intake, right? It would attend to potential microaggressions, discrimination, what's his socialization, internalized depression, intergenerational trauma. I have a colleague who's white, and at their intake, they say to the client, regardless of their identities, as you can see, I'm a white therapist. I want you to know that because I'm white, I have been socialized a certain way, and some of those ways are problematic. So if I ever microaggress against you or assume something that isn't true for your experience, I want us to take the following steps. Bop, 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 bop. And I really think that is a very big equity move, right? Sharing power, allowing the client to take up more space, and just acknowledging the isms and the ists in their midst in the therapy room. You can think to yourself, regardless of your identities, but particularly if you move through the world as white, could I do that? Would it feel good? How would it land? What can I embody that could be similar to that? Okay, let's talk about justice, and then we'll hit liberation. Mindset 6 is justice, right? Sometimes we don't hear this one in the alphabet soup of social justice. It's usually DEI. My new acronym that I'm trying to push out there, maybe y'all can help me spread the word, is L-JEDI. You've probably heard of JEDI, which I love if any Star Wars fans are in the room. But JEDI is justice, equity, diversity, inclusion. I love throwing the L on there. Liberation, justice, equity, diversity, inclusion. So let's stop at the J here. Justice, we usually think more in the legal system, but it is this moral principle of determining just conduct, right? We want to undo the wrongs of an oppressed system, make someone whole, right? Return someone to a pre-impacted state, right? Well, I would love to show this video, but we might not have time. This young woman is talking about justice, right? Really the lack of justice that she's seeing in her community.
So I've been seeing a lot of things talking about people making commentary. Interestingly enough, the ones I've noticed that have been making the commentary are wealthy Black people, making the commentary about we should not be rioting, we should not be looting, we should not be tearing up our own communities. And then there's been an argument of the other side of we should be hitting them in the pocket. We should be focusing on the blackout days where we don't spend money. But I feel like we should do both. And I feel like I support both. And I'll tell you why I support both. I support both because when you have a civil unrest like this, there are three types of people in the streets. There are the protesters, there are the rioters, and there are the looters. The protesters are there because they actually care about what is happening in the community. They want to raise their voices, and they are there strictly to protest. You have the rioters who are angry, who are anarchists, who really just want to f it up, and that's what they're going to do regardless. And then you have the looters. And the looters almost exclusively are just there to do that, to loot. Now, people are like, well, what did you gain? Well, what did you get from looting? I think that as long as we're focusing on the what, We're not focusing on the why, and that's my issue with that. As long as we're focusing on what they're doing, we're not focusing on why they're doing. And some people are like, well, those aren't people who are legitimately angry about what's happening. Those are people who just want to get stuff. Okay, well then, let's go with that. Let's say that's what it is. Let's ask ourselves why in this country in 2020, the financial gap between poor blacks and the rest of the world is at such a distance that people feel like their only hope and only opportunity to get some of the things that we flaunt and flash in front of them all the time is to walk through a broken glass window and get it. That they are so hopeless that getting that necklace, getting that TV, getting that change, getting that bed, getting that phone, whatever it is that they're gonna get, is that in that moment when the riots happen and if they present an opportunity of looting, that's their only opportunity to get it. We need to be questioning that why. Why are people that poor? Why are people that broke? Why are people that food insecure, that clothing insecure, that they feel like their only shot, that they are shooting their shot by walking through a broken glass window to get what they need? And then people want to talk about, well, there's plenty of people who pulled themselves up by their bootstraps and got it on their own. Why can't they do that? Let me explain to you something about economics in America. And I'm so glad that as a child, I got an opportunity to spend time at Push where they taught me this, is that we must never forget that economics was the reason that black people were brought to this country. We came to do the agricultural work in the South and the textile work in the North. Do you understand that? That's what we came to do. We came to do the agricultural work in the South and the textile work in the North. Now, if I right now decided that I wanted to play Monopoly with you, and for 400 rounds of playing Monopoly, I didn't allow you to have any money, I didn't allow you to have anything on the board, I didn't allow for you to have anything. And then we played another 50 rounds of Monopoly, and everything that you gained and you earned while you were playing that round of Monopoly was taken from you. That was Tulsa, that was Rosewood. Those are places where we built black economic wealth, where we were self-sufficient, where we owned our stores, where we owned our property, and they burned them to the ground. So that's 450 years. So for 400 rounds of Monopoly, you don't get to play at all. Not only do you not get to play, you have to play on the behalf of the person that you're playing against. You have to play and make money and earn wealth for them, and then you have to turn it over to them. So then for 50 years, you finally get a little bit and you're allowed to play. And every time that they don't like the way that you're playing, or that you're catching up, or that you're doing something to be self-sufficient, they burn your game. They burn your cards. They burn your Monopoly money. And then finally at the release and the onset of that, they allow you to play and they say, okay, now you catch up. Now at this point, the only way you're going to catch up in the game is if the person shares the wealth, correct? But what if every time you share the wealth, then there's psychological warfare against you to say, oh, you're an equal opportunity hire. So if I played 400 rounds of Monopoly with you and I had to play and give you every dime that I made, and then for 50 years, every time that I played, if you didn't like what I did, you got to burn it like they did in Tulsa and like they did in Rosewood, how can you win? How can you win? You can't win. The game is fixed. So when they say, why do you burn down the community? Why do you burn down your own neighborhood? It's not ours. We don't own anything. We don't own anything. Trevor Noah said it so beautifully last night. There's a social contract that we all have, that if you steal or if I steal, then the person who is the authority comes in and they fix the situation. But the person who fixes the situation is killing us. So the social contract is broken. And if the social contract is broken, why the f do I give a shit about burning the Football Hall of Fame, about burning a Target? You broke the contract when you killed us in the streets and didn't give a f. You broke the contract when for 400 years we played your game and built your wealth. You broke the contract when we built our wealth again on our own by our bootstraps in Tulsa, and you dropped bombs on us. When we built it in Rosewood and you came in and you slaughtered us. You broke the contract, so f your Target. F your Hall of Fame. As far as I'm concerned, they could burn this to the ground. and it still wouldn't be enough. And they are lucky that what Black people are looking for is equality and not revenge.
Justice typically could look like in therapy. Outreach promotion, like, are you going to the communities that need the support? Or are we always demanding that the communities come to us, right? Health promotion, so being preventative, not just responsive. That's the same with primary interventions. And then advocacy, right? As clinicians, we are actually in the trenches. As the healers of many communities, we see first what people are dealing with, right? And how the system is impacting them. And so we're actually uniquely poised to advocate, push back in the degrees of power that we have. This can be emotional support animals, leaves of absences, housing accommodations. Your clinical word, your clinical letter can have weight. I have several clients right now from multiple tech companies who are out on a medical leave, right? So they need that time. They've burnt out and their mental health is suffering, and they wouldn't have gotten that paid time off without a clinical letter. I'm also thinking about gender affirming surgery. Imagine how much power your letter can have, especially in a healthcare system that used to pathologize trans folks, right? So we've moved from gatekeeping to actually advocacy, and we can actually pave a way, cut through some of the oppression for our clients in terms of a justice mindset. So you can pause and reflect to yourself, how comfortable do I feel with some of these forms of advocacy? Right? Have I gotten training on writing these types of letters? Right? Have I looked into WPATH standards or gotten additional training so I can advocate for trans folks? Okay. All right, y'all, we made it. Let's talk about liberation. Oh, so much here, but let me give you a little appetizer on liberation. Many of us, including myself, were not trained in this liberation psychology in our grad school or even beyond. So society says, what's wrong with you, right? A trauma-informed practitioner says, what happened to you? Big shift. A culturally aware trauma-informed practitioner would ask, what happened to you and your people? And what continues to happen? I'm getting the chills. And then a liberation psychologist or healer informed practitioner would ask, what happened to you and your people? And what continues to happen? And how do we honor your ancestral wisdom to heal? And what are the contemporary wounds that we can shift from surviving to thriving, right? Just want you to hold on to this slide because it really kind of shows you the levels of difference in mindset, from pathology to what happened to what's happening intergenerationally to what is happening intergenerationally, and how do we reclaim, one of my favorite words, how do we reclaim all the different ways that you and your people have healed? This requires us to decolonize mental health, which is its whole other workshop. But essentially, liberation is anti-oppression. So it's bringing in that oppression is occurring at all times. Some of us don't touch that so directly. It's holistic, it's systemic, and it's strength-based, right? Okay. So we must shift from clinical neutrality into more of an active opposition to oppression, naming it, processing it, being an accompaniment with it with our clients, okay? So a quick definition for those of us who may be new or hungry for decolonizing mental health, it basically understands that a lot of our theories, methodologies, thought leaders over the centuries have been colonialized or only centers the voices of white men and had pushed all other voices, Eastern medicine, ancestral medicine, and healing, to the margins and delegitimized them. So this is about seeking out and reclaiming the Black Indigenous ways of wisdom and ways of healing, right? Actively in your curriculum, if you're training, in your supervision, if you're monitoring, mentoring, and in your own mindsets, right? So here are just some of the core concepts of liberation psychology. Accompaniment, like really just sitting there with in the stuff with the person and witnessing. Critical consciousness, being able to tell the truth when something not right is happening. I can't tell you the number one microaggression is, what else could it be? You might think you're reframing, but you're also denying a truth, right? So when a person of color tells you about an experience of discrimination, big or small, I was followed in the store, I was denied this promotion because of this identity. And you're like, is it really it? Is that the reason why, or could it be something else? That's really invalidating, right? So being able to walk with that truth, right? And instilling hope. There's a lot of folks during 2020 who were in a deep despair. I myself had to take a month off just because of the vicarious trauma I was enduring. Okay. So this blew my mind when I saw it. There's another picture to the frame. Okay, I see a couple of people nodding. Bernita is nodding. So we have equity. Everyone's got shoes on their feet. Equality. Equity. And we've discriminated to create equity, to create more access. But then we have liberation, right? Why are we squabbling behind the fence? What if we remove the fence? Then people don't need boxes, right? So I always like to leave people with the thought of, what are the fences in healthcare? What are the fences in our organization? What are the fences in our work, right? It's usually insurance, our access, our money. There's a lot of fences when we actually really start thinking about what are the impediments that are causing us to need to have these unique strategies toward equity and justice, right? So it's a big prompt. It's a big thing to think about, but what are the fences inherently built in? Can we pull this down plank by plank? Okay. Quick plug, if you want to dive in more to liberation psychology, this is a great book. It will cover all the different pieces about how it's self-affirming. We include community support, expressive arts. We attend to anger when we're in liberation mindset. We can give coping and resistance strategies. And there's quite a bit of grief, right? Whenever we're dealing with depression, we're also dealing with loss, the things that ought to be different, right? So it actually demands a lot of you as a therapist, right? So I want to bounce over quickly to, we did it, we made it all the way, to how to embody these practices as a social justice clinician. It's not just in the head, but we have to be tender with ourselves while we're embarking on this work. Compassion fatigue is very likely. And so who is your tribe as you're working through this and moving through these mindsets, right? Here are some of the symptoms of compassion fatigue. Take a quick look. Attend to yourself if you're feeling any of those. And of course, the vicarious trauma that I've mentioned. When you're beholding or witnessing someone in the throes of an oppressive system, and even yourself, based on your identities, things will get triggered, right? And you're going to be impacted personally and professionally by those. So being able to have a method of caring for yourself while you're carrying this cause. Things like monitoring your capacity, taking care of your basic physiological and emotional needs, seeking and creating joy as resistance, and knowing that exceptions exist, right? Not everyone is in despair, and really figuring out where those spaces where you're not embroiled in the same content. You might even need to change up your viewing, right? If you spend all day doing liberation work, you might not want to watch certain content or read certain content that's going to be more of the same. I've shifted into romantic comedies and stand-up because I can't take too much of the drama off the clock as well. Okay. And of course, your own therapy. All right. Yes. Oh, no. We have a minute for Q&A.
And thank you so much, Dr. Megan. Another well done and very thorough step-by-step presentation. This is another where I learned so much. And I see some praise in the chat for you. Thank you everyone for being here today. I'll run us through some closing slides. Thank you all so much for attending today. We really do read every bit of feedback that we get on those surveys. So please do complete the survey, the feedback form. That helps us continue to improve on these webinars and other virtual learning opportunities. And with that, I think that is a quick close out.